Welcome back to Reimagine 2020. I'm Yonah Hochhauser, and today I'm glad to be joined by Alex Cahana, Chief Medical Officer at ConsenSys Health. Alex, thanks so much for joining us.
Thanks, Yonah, for having me. It's always a pleasure to be interviewed by you guys.
For sure. Well, I hope it's just as enjoyable for you this time as every other time. Now, to start us off, for those who don't know, tell me a little bit about what ConsenSys Health is and what are some of its goals.
Well, ConsenSys Health, by its name, is a spin-off ConsenSys, and not surprisingly, is the largest healthcare, life science, and blockchain company in the world. I would love to say that we like to blockchainize healthcare and healthify the crypto space, but in all seriousness, it's just like the background shows, to create social impact by these Web 3.0 technologies that are not just distributed ledger technology, but also federated learning, privacy in depth or privacy preserving technologies, and in general, leveraging decentralized economies to improve our planet.
Mm-hmm. Well, we'll talk a little bit later about how you view blockchain and Web 3.0 helping healthcare, but more specifically right now, what has ConsenSys Health done in recent months in relation to COVID-19?
I would say the most important project is building the Elevate Compute federated learning engine. For those who are not familiar with federated learning, I would say that the problem that we see most around COVID is really the question of data and the derived knowledge that comes with it. Data is all over the place. There are multiple sources, and we're not even sure the veracity of many of that data, the integrity of that information, and the ability to audit and trace the data itself. On top of that, right now we're in a moment where all data is applied upon it, big data analytics or artificial intelligence, if you wish. And if these type of technologies are not applied on a robust data set, then what we get is what is called deep fake. So what we get is even a more skewed and biased data set. And without getting too much into the technical issues, it is important to make sure that the information that is analyzed is derived from data that to some extent is pristine and trustworthy, or a single source of truth. And federated learning is a new technology that's been around, I would say, for 2-3 years. And the idea is that instead of sending the data to an algorithm, and the algorithm will analyze it, it's almost like the algorithm will visit the data. I like to think of it as a physician myself as home calls. Instead of going to the hospital and being worried that you'll get infected or mistreated or misdiagnosed or just simply mislabeled, it's more like the doctor comes to you to your home. And the idea of the algorithm coming to the data has a couple of advantages. One advantage is, of course, that you don't have to leave home. So data doesn't have to go from behind the firewall and be vulnerable in its transmission and analytics that are done outside the security premises of whatever organization or source it is. But the second thing is also that it allows collaboration between different sources of data. We know that there are countries, organizations, corporations that have IP or intellectual propriety, have I wouldn't say secret, but they have confidential or private data. And some of it just simply they're not keen on sharing. What federated learning does is almost like the doctor who knocks on everybody's door. So I come and visit you, and I come and visit your mother and your father and the other family, and I build an algorithm in my mind that is able to create a machine learning or a best way to analyze, let's say, for example, COVID-related information. So you can understand that this is very compute intense. It requires a lot of engineer hours and a lot of design. And ConsenSys Health has been working on a COVID-related federated learning engine called Elevate Compute.
Wow. Now, you highlighted on something, a very important issue where there's this contrast, this conflict of interest between, this sharing of ideas, of sharing of research, sharing of medical advancement for the betterment of all mankind. And that's in direct contrast or conflict with a lot of these private companies who are trying to develop a vaccine, a COVID vaccine, and they want to develop it themselves because they want to reap the profits at the end of the day. Do you foresee any technical? I mean, does what you just described? Does this fix that issue? Does this circumvent that conflict of interest?
I think it's an excellent question, an excellent observation, and yes, the short answer is it is one aspect, one technical aspect of that attempt to solve the tension between the private and the public. The tension of the private and the public is not just about IP or the wish to be profitable. It's also the wish to stay personal and private. We are all aware that right now our data is out there in cyberspace. It is used, abused, loosed, and profited by third parties. There are a lot of concerns that central governments are using COVID as a biometric surveillance state. And so there is a true need to preserve our privacy. And so federated learning is, I would say, the machine learning or intelligence part of it. But there are two other important technologies that are worth mentioning that are part of the whole solution. The second is what we call privacy in depth or privacy preserving technologies. They have all kind of fancy names. It's not really that important for our conversation. Zero knowledge cryptography, for example, or multi-party computation is one that is coming out right now. The way I like to explain it is that these are technologies that allow you to perform analysis on data without actually knowing the data source or knowing the data, which is kind of weird to say, how can I solve something without knowing it? The way I like to explain it is imagine, sure, all the listeners know the game Where's Waldo? And so if I ask you, Yonah, where's Waldo? And you say Waldo is here, then that's fine, but then everybody knows everything about Waldo. So instead, could you imagine like we could cloak all that data and we could cloak that page of Where's Waldo way bigger than the book, and there's just a tiny hole, and that hole is over Waldo's head, and I say, here, Yonah, that's where Waldo is. So you know that I know where Waldo is, and I'm not divulging any information. So all these privacy preserving technologies are part of the solution. And the third really is blockchain or distributed ledger technology, which basically are these smart contracts that, or contracts in code that transparently determine the deal or the conditions of how do we plan to do this collaboration or consortium. And it's those three technologies which will allow a new type of economy, a new type of business model, which we believe will be more inclusive. And part of the reasons that we're doing this, for example, in developing economies, like in Africa, you can see in the back, I have the Sustainable Development Goals of the United Nations, is really that is a open green field, so to speak, to leapfrog and not have to go through all the aches and pains of the developed world and go through, just like they don't have landlines that go straight to 5G, they can also go into Web 3.0 tools and create that new business model that is more inclusive and I would like to say more ethical by design.
Mm-hmm. Now, you mentioned those three different aspects, this three-prong approach, if you will, to this advancement. What is stopping the advancement here? Is any one of those three prongs not ready yet? Or is there an issue of integrating these three new technologies together? Or is it something else? Is it the human factor that's just not ready to accept all three together?
I think it's all three, but if I would have to choose, the most important one is always the human factor. Technology is something fluid. It always needs to be improved. V1, V2, V3 is always increasing the user interface and the user experience. But the technologies are ripe. We're at a point where they can be used. Now, we can argue if they're enterprise ready, if they've been, the main test has been stress test enough. We can argue if they are nice enough, you know, to kind of understand all this. But at the end of the day, it's really about people embracing this idea that this type of way of doing things is possible. And I think that we're not there yet. And, you know, it's not, there are incumbents, of course, that are always worried about their livelihood. But the main problem is really to understand what is the role of data and what do we mean when we say data. Because data is just a word. There's raw data that is something that researchers like myself look in. So that is like everything and anything. And I think we have like 160 some exabytes of that in the universe. Then there's metadata, which basically speaks on the characteristics of that data. And then of course there's actionable information, which is really what people are interested in. They're really interested in, okay, so what do I do now when I have this data? What do I change in my behavior in order to, you know, improve my current situation? And I think that people look, and for the sake of the use of the word data, we mean actionable information. We look at data, I would say, as something to improve operations. We're using it as an optimizer. You know, how can I increase my margins? How can I make things better, cheaper, faster, and so forth? But what we don't look at data is what it is, you know, as dignified work. And that's a different type of concept. So what I mean by saying dignified work or data as labor is, for example, I am my actions. And my actions are captured by data. So if someone takes this data and uses it and abuses it and loses it and sells it without my consent or without my implied or full consent, they're actually taking a piece of me. Mm-hmm. And so, although we talk about privacy preserving technologies, they're actually dignity preserving technology. Mm-hmm. And so they're taking a little piece of my dignity. And so a lot of this is, you know, reminds us other chapters in our history where some people took from other people their dignity for their own profit. So as we move from the I would say, industrial age into the digital age, or from the digital age into the information age, we have to be a little bit more careful and a little bit more thoughtful on how we allow our data, not just from the sake of privacy and security and digital footprint, but also what does this data mean? And so if we think of data as a piece of us, then the flip side of it is that it can, I would say, even be translated into value, and that value can represent a supplement to our income. So especially in healthcare, this becomes interesting because we know that wellness and avoiding chronic diseases has to do with behavior modification. So if I don't smoke or if I exercise, then I can actually make money out of my good behavior. And so although there are discussions of universal basic income and all this, we can think of this type of Web3 revolution as a universal health income. And this is a new way of thinking of things. So all this to say is that people have to go through a process to focus on what does it mean when you allow to be traced and geolocated, when you join Facebook groups and you just say whatever you want to say, while in the background there are natural language processing algorithms that are reading every single word. What does it mean that there are algorithms out there that eventually can even know you better than you know you, and that you don't own it and you don't permit it? So I think that once people understand the importance of self-sovereignty, of that ownership of that information, then people will embrace better these technologies that we mentioned that would solve the problem between the tension of the public and the private sphere.
That's a very interesting point you make, because historically, if you look at the medical field and especially organ donation, market dynamics and market supply don't really work, because if you leave it open to a free market, it kind of incentivizes the lower class, the lower income, to have to sell their kidneys. So it incentivizes kind of negative behavior, not negative, but unhealthy behavior. What you're speaking here is actually allowing people to incentivize themselves monetarily with good health, with improving their health. So I think that's a really interesting outlook that I have not heard yet, and that gives me a lot of hope. In, let's say, this grim medical situation we find now, about that. That's very exciting. But I wanted to ask you a question on a point you made earlier, where you were mentioning that one of the big issues when it comes to COVID is this lack of clear data, pristine data, I believe was the word you used, and getting it all in one place. But how does the technology currently, even blockchain, it solves a lot of problems with manipulating the data once it's in the system, but how does it help with making sure that the inputted data is correct when it's actually inputted? How is it making sure that certain countries that have an incentive to lie about their data, or even individuals that have an incentive to lie about their data, how is technology today helping clear up that input?
So this is a question that I hear many times, which talks to the question of trust. And so when people ask me what is blockchain, I don't use words like public ledger or proof of work and things like that. I say that blockchain is the software solution to the social problem of trust. And when I talk about trust, I don't talk about, oh, Alex, I believe you, you seem like a decent guy, and I really love this talk, and it's so wonderful that, all these predatory practices are going to be extinguished because of technology. What I'm talking about is computational trust. Now, you're absolutely right that there's a significant difference between structured and unstructured data. Going back to COVID, it's very different to say if I had a test, a PCR test, and it says positive or negative. Okay, that's binary, that's structured, that's something that is trustworthy and reliable because of its computational finality and veracity. Whereas patient-reported outcome, I'm coughing, I'm not coughing, I have this, I have that, I like it, I don't like it, that's non-structured. And so it is clear that the different types of data and raw data have different levels of veracity, finality, integrity that need to be accounted for. The answer to all that, how do you make sure that this is trustworthy, is really by what you said in the question, is the incentives. How do you incentivize to make sure that the information that you'll give will be the right one? And that really is done by the virtue of distributed ledger technology, which is transparent and which is immutable, can't be tampered, it can't be changed after fact. And you can create monetary and non-monetary incentives in it that because it is a distributed ledger, because other people are looking at it. It can be permissioned, which is just a group of people that you allow them to look at, or it can be permissionless, where everybody's looking at it. You can make sure that the data that is put in is correct. What happens with centralized systems is that they are not only security vulnerable, in the sense that they're like this honeypot that everybody wants to hack, but also they are censorship vulnerable and they're collusion vulnerable. And we see this right now, even in the United States. The government here is not interested in testing. The government here is not interested in inflating numbers and as not to look bad. So there are people that are, looking at the numbers, and there are real concerns that they are fudging the numbers for political reasons. And if it's here in the United States, I'm sure it can be in many other states and countries all over the world. But imagine that those pieces of information would be around the world, that they would be transparent, that you would have people that have access, a network of trust agents that could look at it, oracles, validators, and can make sure that the transactions do make sense. So I think that the net of making sure that the data has that computational trust is by the virtues of decentralization, distribution, transparency, and the ability to track and to audit the trail of how that data is treated.
Now, it seems like blockchain, makes perfect sense for this, for all the reasons that you just mentioned. And you've actually said in the past, or I believe I read it somewhere, that one of the biggest problems, or one of the biggest wastes, is miscommunication between medical professionals and the healthcare industry. Costs a staggering $11 billion a year. So clearly there is obvious need for this here. But for anyone, I mean, you clearly know this, but for anyone who's worked in the medical and healthcare industry, they know that when it comes to healthcare, there is a tremendous amount of regulation and slow regulatory approval and change for anything that's done here. Do you think that government regulatory restrictions are keeping up with the pace of innovation here in this field?
Yeah, the short answer is no, but it's also no by design. So when I say that regulations don't keep up or they're behind, it's not necessarily a bad thing. I've always been very wary of codifying everything that we do into law. Laws are usually reactive to situations or economic conditions or practices that disenfranchise individuals or communities. So, for example, if we find out that someone is dumping pollutants into the water, then we have a law that says, you know what, dumping pollutants into the water is not allowed. So I think that we first have to give the market a chance. We have to give time for technology to create a sustainable ecosystem that allows everybody to be included in a peer-to-peer economic activity. It is true that the digital literacy and also the financial literacy of people in general, but our lawmakers in particular, is not high. And so a lot of the laws that are coming out there are really decades behind what we're doing. If we look into the United States, for example, the privacy laws that are called HIPAA laws that were written in the mid-90s are still written for a paper age where the pricing of transfer of information is weighed in amounts of PDF pages. But even in Europe, where there is more sensibility to privacy and avoiding the infringement on our privacy and the, I would say, right to be forgotten or have a controlled digital footprint through what they call the GDPR, even that will always be 1 or 1.5 steps behind. I think that what's more important than seeing the governments or the regulatory authorities as a barrier to adoption, I think that really what makes these things more sustainable is the creation of economic models that bring value to the maximum amount of people. So that's a very fancy way of saying that I will use this because it is helpful. And it is helpful to me without being harmful or hurtful to you. I think that's really what we're talking about. And you mentioned before the problem of the free market. And I think that one of the mistakes that the free market has gone at least since 2008, and where Bitcoin specifically has been a reactionary technology to the centralized federal banking system, is really how do we create a balanced ecosystem that my well-being doesn't have to be attached to actually creating a infringement or a predatory practice for you. So the market actually shouldn't be free. It should be open. And it's a very important distinction, because a free market means it's free for producers, for non-producers, but also for destroyers. There are actors that actually, by their action, can destroy the market. So the market shouldn't be open for those type of people. It should be open just for producers. And the definition of producers is not what I think is a producer, but really in numbers, who allows the production or productivity of the market. And that is not only in economy and capital markets, but that, for example, is in democracy. Democracy, we say, yes, it's free for all. No, because there are the limits. If you are not contributing to democracy, or on the other hand, you are hurting democracy by your actions and you're threatening the sustainability and the viability of the system should be designed in such a way that it disallows you to continue to create these hurtful activities that can put in question the viability of the system at large.
Now, you know, that sounds, to someone like me and you, you know, the greatest good for the greatest amount of people, doing good without hurting others, those all sound like very, very noble causes. But I don't want to be too cynical, but those might not necessarily have been the motivations for all players and big companies in the healthcare industry today and forever. Is there, in your experience in dealing with them, has there been motivation and willingness on the parts of current traditional healthcare providers, healthcare companies, pharmaceutical companies, to actually look into these new technologies to try to change the status quo of how the industry works today?
Yeah, it's you know, what I said, it's an excellent remark. What I said right now is not ideological. It's just good business. I had a CEO, pharma CEO friend who came to me and said, "Oh, Alex, why do people don't love me? Here I am, you know, I'm doing stuff to help cure cancer and all these things and all that." And he was really chagrined by the bad reputation that, in this case, biopharma is getting by what the general public perceives as self-promoting or self-profit actions. And I said, you know what, the business model, people don't like you because of the business model. And the business model is similar to the story of the guy who went to the pharmacy to get aspirin. And when he left, the pharmacist realized that instead of aspirin, he gave them cyanide. So he ran to him and said, "Sir, I made a mistake. Instead of aspirin, I gave you cyanide." So the client said, "What's the difference?" He said, "You still owe me $1.25. So the point being that sustainable business is not an ideology. It's not a political stance. Sustainable business, all what it means is that you put people before the product, before profit. So if you short everything and you put profit first, you understand that this is not a sustainable model. Now, we can argue, how do you create economic systems that promote long-term vision? We've seen COVID, the lack of capacity and lack of capability of short-termism. The fact that we have, for example, a just enough supply chain. We have a little bit of surge in a virus, and suddenly we don't have toilet paper and hand sanitizers. Why? Because it's not that we don't have toilet paper or hand sanitizer or inability to produce them. It's just that we slid the margins so tight that we don't want to have anything in the inventory more than 24 hours. So these are just design questions. That's why when people say to me, when we go back to normal, I say, we're not going to go back to normal. It's because normal is what got us into this trouble. And so I think that once people start to understand that it's not about recovery, we're not going to recover, that comes from the word to cover up. We need to redesign. So all these technologies that are based on decentralization, that are based on network effects, that are based on recruiting people to join the economic activity have absolute business sense. This is not to do less business. This is to do more business. This is to do more profit, but also more profit to more people will lift the profit, and not this income disparity that we see that is so acute and so hard with so many people outside the circle of employment, that when you don't spend, I don't have income. And that's why everything is going to tank. And that's why we're able to leapfrog these developing economies, because they understand the fragility in terms of capacities and capabilities of centralized systems. And I think it's also a generational thing. I think that, you know, I'm an old guy. I like to say that I'm 35 years old with 20 years of experience. But for example, for your generation, it's absolutely normal that this is how it's supposed to be. It makes no sense that, you know, I would pay from my tax dollars medicine or research for medicine that would be bought by 4 guys that I know in New York, that would be spinned off and sold to a pharma company for a multi-billion-dollar deal so that they could sell a drug that I cannot afford. Makes absolute no business sense behind it. So I think that we shouldn't think of disintermediation. People are not going to go away. Governments are not going to disappear. Industry is not going to disappear. Insurance and payers are not going to disappear. What we need to think about is re-intermediations. How do we insert this new type of value into the value chain? So it's not just a supply chain of moving things from point A to point B, but a value chain of where I can participate in maintaining this network, that I want the vaccine to succeed. I want Amazon to succeed because I want to be part of that economic success.
Well, we've been speaking a lot about these ideas of how this technology could change and could bring about this new reality. But is there currently projects right now that you see that give you hope? Or are there currently blockchain and Web 3.0 projects that you're looking at and saying, wow, you know, maybe not today, but possibly tomorrow, this could really do this, bring the shift that we're talking about in this interview?
Absolutely, absolutely. And it's really, you know, the COVID pandemic really accelerated the utilization or the application of distributed ledger technology in general, but also the combination of distributed ledger technology enhanced federated learning with privacy in-depth technologies as we speak. So there are, for example, consortias out there, pharma consortias, payer consortias, the Hospital Utility Network, the Synapse Alliance, the United States Health and Human Services has a purchasing program called Accelerate. All are using blockchain as a network effect to optimize their operations. In general, I would say for the audience that I see 5 use cases of these type of technologies in healthcare that either are happening as we speak or will happen in the very near future. What is happening since, I would say, 2019 for sure, is supply chain. It is clear that the need to trace and audit and to know the provenance of goods and to transport them using blockchain is something that is not difficult to figure out. And there are multiple enterprises, both in healthcare and in other industries, that are using different decentralized applications and platforms to ensure that the piece of salmon that you're eating on your plate is actually salmon and not some type of fish that was injected some pink color into it. And this involves, of course, not only the use of blockchain technology, but also the use of Internet of Things and RFID tagging and all kinds of monitoring and tracking capabilities. So that is something that is used, and we can think of supply chain not only of goods, but also as services. And that's almost like a no-brainer, and I think that within the next 3 to 5 years, that actually will be the standard. The next one that has been starting to be used in the US, but also in Europe and in Asia, is the idea of credentialing. And again, it is similar to supply chain, where we want to understand the professional value chain of people that are doing things. So for example, in medicine, you want to make sure that the doctor who's treating you is really a doctor, that I was trained in Tel Aviv University, that I did my postgrad at Vanderbilt University, that I'm a professor in pain medicine, that I did X amounts of procedures. And so it is important that that credentialing that could be represented with a simple QR code in my app and on my phone really says that I am who I am, and not like now LinkedIn, I can put in, you know, Alex Cahana, CMO of and King of the World. And, you know, nobody's going to call me and say, what do you mean by King of the World? So those type of credentialings already exist, things that have been developed for physicians, for nurses, for other healthcare professionals. And that is also something that not only introduces efficiencies into the system, but also is you know, important to that trust that we are talking about. So the credentialing itself could be centralized. You know, we're not decentralizing credentialing that the world says that I'm at the University of Tel Aviv. That university can do it on its own, but it's that the transmission is trustless, that you don't need third parties, a notary, or I don't know who from Kinko to sign on it and say, yeah, I am who I am. So that's the second use case. Other things that enterprises are starting to use in healthcare come now with what is happening as we speak, and that is the development of decentralized finance, or what is known as DeFi. There are now solutions that are coming out there, the ability to create smart contracts that can define value assets that can be exchanged and traded in a decentralized way is something that is happening as we speak. And the equivalence of it in healthcare would look that instead of dollars, you would use the word data. And that is very interesting. I'm very hopeful and curious to see how that develops in the field. It can go into optimization and automation of revenue cycle management, especially in the US. We know that the payment system is very fragmented and multi-phased, and everybody is unhappy. So this whole idea of reassessing, re-intermediating, reducing costs because of that friction is a definite solution that, you know, will happen. And the second aspect of it is really the self-sovereign electronic health record. And that is something amazing. The ability that you can have a portable electronic health record on your phone that you can take with you to any place will solve the problem of interoperability. We're actually doing a project in Africa now in 8 different countries where you can move from place to place and you have your electronic health record in your phone. It's actually designed also not only for smartphones, but also for feature or dumb phones. It's almost to the point where we do it with no need for internet also, because there's not reliable internet coverage in the continent. And so the ability to have a health data that is connected to a digital identity or a self-sovereign identity is crucial. And that, if connected to a token, can also bring all this, what we talked about, the universal health income, this idea that I can incentivize people. So if I boil water, if I take my kid for a vaccination, if I go for my prenatal care or adhere to my HIV treatment, I can actually make 25 cents, 50 cents, $1 a day. And when you make $1 a day, an additional $1 a day for being healthy is a lot of money. And I can see this also in the US in certain parts of our country where maybe $20 or $150 or $100 a day would make a big difference, including participation in clinical trials. So this whole idea of the portable, self-sovereign electronic health record is something huge. And then, of course, there are the things that maybe I won't be able to see in my lifetime, but this whole idea of distributed governance, this idea of DAOs, distributed autonomous organizations of any community. It could be patients, it could be healthcare professionals, where people can communicate between themselves in a safe, private garden, where they can interact with each other through ConsenSys, they can vote, they can say things that would give them not only capital but social capital. That really is the future of not only democracy and liquid democracy, but more what I talk about is holacracy, the idea to self-assemble and self-execute themselves. So we are in the precipice of a new era. I explain to people why this is a new era. I recently saw this great channel on YouTube called Useful Charts. It puts everything you want to know on charts. And so I looked at history on charts. And it was really, really revealing visually. They looked at the history since the written language, so 5,500 years of history. On the y-axis is 55 centuries, and on the x-axis are the continents. And when you look at that, two things you see. One is you see that in the world, when things happen, they happen everywhere. And when they don't happen everywhere. So for example, I know about the Greek and Roman Empire because I was educated in Western education. But it still doesn't matter. It doesn't mean that the Han Dynasty did a whole bunch of stuff in China and Asia, that there were the Kush and Nubians in Africa, and that there were Mayans in Central America. So when things happen, they happen everywhere. But the second thing, which I think is very interesting, is that when you move from epoch to epoch, when you move from the Bronze Age to the Iron Age, from iron to antiquity, from antiquity to Middle Ages, and then afterwards to the modern age, it's always because of one of two things. Either it is a climate catastrophe, like the mini ice age or the bubonic plague or something of that sort, or because there was some social unrest that came from it. And I think that this is what we're feeling right now. That the reason we have the sense that things are changing because there's climate and a biological event is causing us to say, wait a second, things are changing. And this conversation that we had, this morning about blockchain and federated learning and zero knowledge proof, these are all manifestations of really thinking, how can we not only create a better world, but how can we create a sustainable world in front of this biological warfare, if you wish, that we are now going through. And if anything, when people ask me, so Dr. Cahana, what's the difference between COVID and now? And they expect me to say, well, I'm all virtual, I don't eat out. I say to them, it's actually that people are calling me and saying, what was that thing you're working on, blockchain? Could you explain that to me? And so I think this is why this is an exciting time.
You mentioned, that you were a student of history, which is obviously, that's no wonder you're so smart. But, through all of history, you mentioned when things happen, they kind of happen everywhere. But if you were there at the time, you wouldn't have known it. There wasn't an internet. There wasn't a way of really keeping your finger on the pulse on a global scale. And to make that point stronger, there wasn't a global organization that kind of looked over everything. And today we have the United Nations, and we could debate how good of a job they do at it, but we have them. They're there, and you're actually the blockchain medical expert at the UN. So I wanted to ask you, you're there at the UN. One, how seriously is the UN looking at these new futuristic technologies like blockchain? And two, which country or region of the world do you think is leaning hardest into and embracing this new technology?
Great question. I would say before my answer on the UN, I would say that these are special times when you say that we have the internet or when we have these global institutions as opposed to previous times. And I think that what technology has brought us is that if before we could have said that we're doing wrong things because of ignorance, Now we're doing it because of ineptitude. In other words, we know what we're supposed to do to combat climate change. We know what we're supposed to do to combat poverty, hunger, inequality. We're just not doing it by choice. And so in that sense, this is a unique time and also a unique opportunity to really communicate these best models of sustainability. And I too, before I was inside the UN, was, I would say, tepid, skeptical, but tepid about their impact. But being now close in it, I am profoundly impressed by the deep thinking that is occurring there. Because it is not easy to speak a language that is both culturally, racially, ethnically, and politically sensitive to everyone. Everybody comes in with their own beliefs, with their own history, with their own culture, their own religion or non-religion. And everyone also thinks that they figured it out. So it is an infinite exercise of not only knowledge and intelligence, but also humility and empathy. And we need to exercise that type of radical empathy. Mm-hmm. And so I think that to answer your question, the UN is embracing, and they actually came out with in April, a very serious blockchain paper. I was very pleased to be a co-signator on that work. And there are a couple of very important, I would say, projects in the SDGs that are involved with blockchain. I, of course, am interested in SDG 3, which is health, 10, which is inequality, and 16, which is peace and justice, but more so 16.9, which is universal identity for everyone. Think about, everyone having a birth certificate. Because if you don't have a birth certificate, then suddenly you can't vote. And if you can't vote, you can't be part of society. So these are these inch little things that make a huge difference in somebody's life. Mm-hmm. I would say that parts of the world, different parts have different emphasis on what's going on. So there's not one place that is more evolved than others. And again, that is in the spirit of multilateralism and a global approach. Europe is very, very advanced in their discussions on privacy, their discussions on the idea of liberty and autonomy. The US is very advanced, not surprisingly, on the business. They're trying to figure out, they're developing tools, and the regulatory authority is trying to figure out between the SEC, the CFTC, the IRS, they're really trying to figure out what are we going to do here, because they understand that this is how the business world is going to do. Asia has a very interesting approach of really applying technology in general to make smart cities and smart countries, very similar to what's happening in the Gulf. And so their approaches are very ambitious and holistic, which is in line with, for example, Eastern medicine, which is, very holistic in its approach. The projects that are happening in Latin and South America are in their infancy, but whatever pertains to healthcare, there is an interest of how do we implement these technologies, because there is a paucity of infrastructure. And Africa, I think for me, I'm biased because I go there a lot. It is just a blue ocean of opportunity, because it's a young population. There are countries that over 50% of the people are under 25 years old. They just get it. And I sit in the most remote and destitute places in the continent, and they talk to me tech language without using these words. They're talking to me about decentralization, distribution, disintermediation, and it's embedded in their idea of how to create a peer-to-peer economy where people actually interact with each other without the need of a trust agent that you cannot trust. So it is a global, it is an absolutely global, I would say, effort with different emphasis in different areas in the world.
Well, Kahana, you have so much on your plate, ranging all over the world. I really appreciate you taking this time, sitting down with us to help explain to us the connection between blockchain and the opportunities that blockchain and Web 3.0 afford healthcare, Corona, across the world. So thank you so much for taking the time. And for all our viewers at REIMAGINE 2020, I'm Yonah Hochhauser. Thanks for watching.